there are some other important things that really help facilitate this whole process. We know, for example, that clinicians, and this is evidence-based for you, clinicians will spend no more than 2 minutes looking for an answer before abandoning a search. Some quite interesting research has been done around that. The evidence needs to be provided at the point of care if it's going to be used. They're not going to walk down the corridor to find it and come back. The patients don't want to see that happen either. The clinicians don't turn around and say, don't go away, I'll come back with an answer soon enough. That's really not the way it should be working. And systematic review of these issues has shown that point of care access, easy to use point of access, does see significant practice improvements. So over all the years of doing this and knowing that, there are some little tricks that we've found about how to do it better. And when I say it, that is this use of getting evidence in the right place to inform practice so that people will actually embrace it, engage it, and it really does, because practice change is hard, it's difficult. If you can do these small little things, it can help make it easier, and they all are really important, rather than just saying, here it is, because most people won't do that. They need some help. And what do we know in our experience? Well, first of all, if it's made easy and accessible. So it needs to be where decisions are being made. That information needs to be at the bedside. In essence, we live in a technological world. Computers need to be available where possible. I know there are some facilities around the world who have thousands of computers. Others don't. And we try and work with those organisations, particularly in developing countries, about how we can present our materials in a different way, so that they can actually use that evidence, as long as it's contextualised and appropriate for them in their settings. But for the most part, for most of us, the computers, the access to the information needs to be right at the right spot. Besides that, we've found that, again, in that how rapid you have to be to find the information, having a tailored landing page and providing access to these resources doesn't have to be just JB Ovid, but any resources that you librarians have decided that yes, our clinical partners should be using this, or within our hospital we should be using this, but getting it right, getting it all in the same place alongside each other, for example, so it's easy to find and it's right there where they need it and they're not going through page after page after page to find it. We're working with some of our partners in South Australia Health back at the University of Adelaide, and we're developing a desktop icon, so it's always there, every click on every computer. And often this stuff really works well if, when the patient information is up on the screen, that there are links to relevant information directly from there. There are some organisations which have managed to integrate this information into those systems really effectively. The other thing that is incredibly important with a system like this, but really any system. I mean, there are a lot of clinicians out there who could not necessarily search PubMed effectively. Okay, it really is an art and a science to a lot of what, for example, librarians like yourself do in terms of being specialists at finding information and using all of these different tools, many of which do the same thing. And we ask people who've never encountered this before to use all different platforms to search all different databases, for example. So it's really important, and this is again a part of that partnership and a part where librarians can become champions, for example, but to really work with people about how to find, clinicians, about how to find relevant information. And that's all about education. Now that doesn't necessarily mean that a librarian has to meet with every nurse in the hospital, but certainly the upper tier there of the nurse educators and the medical educators and the managers, so that they're all fully aware of what this resource is and how to make the most of it. Now that also branches off into the tools. I wouldn't suggest that a librarian needs to know how to conduct all the niceties of a clinical audit, but the principles of the tool and how it works, when you pair a librarian like yourself next to a nurse educator, you'll find how rapidly the knowledge, how it all comes together, and how the systems, just by virtue of what they're trying to do and get information from point A to point B, how they marry up really nicely with that sort of expertise in the same room. I keep coming back to this, and you'll see this now in the second half of the presentation again. A lot of these things that I'm talking about, both Anne and Kathy will touch on. and I will again when we speak about champions also, and particularly with librarian champions, but they're essential. If there aren't these sorts of individuals, and I'm talking about champions of using evidence to inform practice, then it will be a really difficult step forward. It would be almost impossible, I'd say. Someone has to turn around and say, hey, this is worth doing. But they're the sorts of individuals that, for a successful rollout, we've realised that we have to work really closely with them, okay, and really form a partnership, and not just us with them, but also those individuals within an organisation, because no one person can do it alone, and they really do come together in teams, and these sorts of people gravitate towards each other, so they shouldn't be too hard to find. But these who realise and embrace evidence-informed decision making, it is helpful, because we live in a technological world now, that they are a bit tech savvy, that they understand something about systems and playing around in computers. And another really important thing is, despite everything, that they need the time to be able to manage this and deal with this. And ideally, and I know in some places now, it's actually becoming a recognised role to really get evidence into practice. And here they, across these different champions or the like, they don't all have to be experts at everything. Some will have basic skills, some will have advanced skills, but so long as there's a mix and people are working together in collaboration and in partnership towards a similar goal, and we're all heading in the same place to improve patient care, then in our experience it's a recipe for success.